Hi, Sachin, how are you doing today?
Great and good to see you again.
Good to see you again. Thanks for joining us here for an update. Maybe you can give us a brief background and overview about Think Research for some of the people who haven't joined our conference a few weeks ago.
Great. Yeah. So what we do is we get new evidence and information, essentially best practices, into the hands of doctors, nurses, and pharmacists. Okay. So we make sure our healthcare providers are practicing up-to-date medicine. Okay. And so our footprint today is more than 300,000 clinicians across more than 13,000 facilities that license our solutions. So, really big footprint, and coast to coast across Canada. A lot of business now, growing early and growing, but lots of business in the US, Ireland, UK, Australia, and the Middle East. So we're getting there.
Great. So what are the applications of some of the products and services? Or in a nutshell, how do you charge companies? What's
Yeah.
your model?
Yeah, so clinicians that need to use our solutions, like doctors, nurses, and pharmacists, to keep their practices up to date, they'll pay license fees, typically through their organization. So it's not the doctors that pay themselves; it'll be their hospital or their clinic or their pharmacy chain, and we'll charge on a software as a service basis. So this is recurring revenue, right? So you might get $100 per pharmacist per month, or for doctors, we can sometimes see $50 to $100 per month. So it really varies depending on what they're using us for. But those are the kinds of software as a service fees that we get, right? And just by way of example, one of our key applications, we're the top provider of medical education for clinicians here in Canada. And as you know, all doctors, nurses, and pharmacists need to get their continuing medical education credits in order to maintain their licenses, right? So we become a really key part of what they need to do each year.
So maybe to jump some of the updates of your company developments recently. The company recently struck a partnership with St. George's University Hospital. So maybe you can elaborate a bit on that and how significant is that or benefits to your company.
Yeah, absolutely. So that we're super excited about that. That's a big push on our part into the UK health system, the NHS, right? And what that'll do for us is it's a very well-known health system. We will be providing them with what's called their decision support tools and pathways. So basically, the doctors will be using our decision pathways in order to make decisions on how to treat patients within the hospital. That's a big deal for us, and it'll be a very big showcase for us as we move into the rest of the NHS. So you start small, you prove yourself, and our objective is to be all the way throughout the NHS over time.
Great. Let's talk about more overall about your strategy and how do you what's your strategy that you use to compete with others, or if there's any competition in the space, and what do you see the major risks or challenges in growing your business in the future?
Yeah. Listen, our growth strategy is pretty simple, right? We need to get more users, right? And we do that by getting more facilities that license us, right? So we have a big sales and marketing team that pushes our solutions out. Number two, we need to be able to, once we get a user, we want to sell them another product, right? We have enough products that we should be upselling all of our users to a second product. And today, there's a lot of room to grow there, right? Each user is using approximately just over one product. So there's opportunity to get them to two products and three products and so on and so forth, right? And lastly, we want new types of content to put to our audience. So think about it this way. We have there's lots of different types of medical professionals, right? We have great content for oncologists. We have great content for pharmacists. But what about all these other areas? We want better and deeper content for cardiologists and endocrinologists and so on and so forth, right? So there's lots of new verticals of content that we can add to our system. right? If you want an analogy, what we should think about us as trying to build for healthcare what Bloomberg is to finance, right? A really critical information source that becomes a core part of a finance professional's life, right? Really makes them more effective. Very similar to that. That's what we're building for healthcare.
So I think research like in today's already in quite a few different markets like Canada, US, UK, Europe, or even the Middle East. So which markets do you think that create the most potential for you?
Yeah, listen, those markets that we're in right now we could grow, 10, 20, 30 times our size just by focusing on the markets that we're in. That being said, we have users today in other markets, in places in all the way throughout Asia, South Asia, China, and so on and so forth. Just small numbers of users. So we know that we're relevant to other markets, right? Because we have some small numbers of users there, right? So ultimately, we will be pursuing a global strategy, and markets throughout the world are interesting to us. The way to think about it is evidence doesn't stop at a border, right? Evidence and knowledge doesn't stop at a border, right? Best practices don't stop at a border, right? And patients everywhere need better healthcare. So ultimately, we think it can be a global strategy. But today we're focused on certain markets because that's where we've got sales and marketing staff.
So in summary, why should investors consider investing into your company, Think Research, now?
Yeah, listen, healthcare is a massive market globally. It's $10 trillion. $7 trillion of that is labor, right? And think about it this way. Over the coming 10 or 20 years, there are hundreds of millions, if not billions of people that will be moving into the middle class and upper middle class. They will become bigger and bigger consumers of healthcare, right? And guess what's happening on the other side? There's going to be a massive shortage of doctors, nurses, and pharmacists. Massive, right? We're already seeing it in developed economies. Right? So these two things don't match. We're going to need software in the middle that helps doctors to do their work more efficiently, right? And to see more patients more effectively with better outcomes. That's fundamentally what we do. So we think we're in the right space for the next 5, 10, 20 years of healthcare.
This is indeed fascinating to how I would say you changes the whole industry on the healthcare side.
Thank you. And listen, we're also a good financial investment. Today we're trading at less than 0.5x of our revenue. So it's never a better time. And I can say I was recently in the market buying stock myself.
Mm-hmm. Yeah, so thank you for your time here today and for giving us an update so investors can continue to follow your story.
Thank you, and good to see you again.
Good to see you.